Hi, I'm Erin with Best Life Physical Therapy, and today I'd like to talk to you about how we can treat our subconscious mind like a small child. So if your subconscious mind is the source of the pain that you're experiencing, and you're experiencing this pain because of a fear cycle, then what that part of your subconscious really needs is to be treated very much like you would treat a small child. So if you are a parent or dealt with small children, then you know what these things are. And they are, and I'd like you to actually start to treat yourself that way. So that's actually having self-compassion, but it's also kind of getting back into some things that might be different than the way that you've been thinking about yourself in your brain, that you're in the current present state that you're in. So if you have a small child that is, having a little tantrum or a fit, how would you treat that child? You would probably give that child a hug. You would talk soothingly. You would say things that are calming to that child. You might tell a story. So telling a story, so that this is where maybe visualizations of positive outcomes would come in. We tell a story that's going to be, this is what we're going to be doing, and in 3 months time from now I'm going to be playing pickleball and I won't have pain afterwards. And but try to focus on the positives with that, of course. And then tickle, do something joyful and playful with with that part. So that may mean doing something fun. You might need to take your focus off of pain and go and do something that's actually fun, or watch a comedy or something like that that is going to be more self-compassion toward that part. But treating that part of your brain in a different way is one of the ways that we are going to get out of this. When we sometimes, and you may find as you're going along with this process that I can see that my pain is decreasing in this, but then it might come up in another way, like now I've got a stomach ache, or now I have fatigue that's coming, or now I don't have pain there anymore, but I feel very anxious. And that is just your brain giving you another message saying, and the brain will do that. And if it happens, it's okay. So just know that if the pain goes from one part of your body to another, or from one, system to another, that is still okay. And that you don't have to fight it, and you don't have to, predict that it might come either. But if it does, just know that it's okay. And that you just keep on learning. It's a process, learning how to love yourself and take care of yourself and deal with stressors. And there may be some things that you have to change in your life, like you might have to stand up to someone in your life, or change something about a relationship that you have, and your brain doesn't know how to speak English or whatever language that you speak, but it is trying to tell you this message that is what needs to be done. So continuing to work on this process of self-compassion, treating that part of your brain like a small child, and just rewiring your brain, which takes time, and just consistency and persistence is going to be very helpful in changing the path of this neuroplastic pain that you're having right now.